We're good? All right, let's go ahead and do a testing before we begin the class today. Testing, testing. Can you guys hear me through the webinar? Testing, testing. Good, at least someone is. I'm trying to wake up. Testing, testing. One, two, three. Are we good? Okay, perfect. Good morning, everyone. Welcome to our eLotus webinar today. My name is Donna, and I'll be your host and your moderator for today's class. Here at Lotus Institute of Integrative Medicine, we've been holding educational seminars and webinars for over 2 decades now. And it's been such a wonderful journey filled with many experiences and lessons taught by speakers who are not only experts in their respected fields, but more importantly, they're willing to share their wealth of knowledge with all of us. We believe that the future of TCM and the advancement of Chinese medicine can only be obtained through continued growth, learning, and progress. And that's our goal here at eLotus, and we're so glad to have you join us today. So before we begin, let's go ahead and give you guys a short tour of our webinar room. But before we start, actually, how many of you, this is your very first webinar? Please go ahead and type first into the chat room. That way we get an idea of who's new, and we welcome you. Oh, yeah. Oh, no wonder. We were wondering why no one was typing. We were a little bit up on the chat room. Perfect. And how many of you, this is your first Jimmy Yen class? If this is your first, type in Jimmy. You're not old, you're experienced. Like fine wine, it gets better with age. Oh, wonderful. Good. You guys are in for a great treat. The way Jimmy teaches, he's very clear, and it's just short and to the point, and the learning curve is really, what is the word? Short? Is that short? I mean, what I'm trying to say is you're going to learn really quickly, and you can apply it right in your practice on Monday, right in your clinic, right away. All right, so what you are seeing on your screen. On the top left-hand corner, you'll find the video feed, and to the right of the video feed, you will find the PowerPoint for today's class. And there are lecture notes available for download. There are 6 slides to a page, and there's also 2 slides to a page, so you can pick whichever one you would like to download. And on the bottom, you'll find 2 boxes. The first box to your left is the chat room, and here in the chat room is where you can connect with your colleagues who are also attending today's webinar live. If you want a private chat, all you need to do is click on the menu icon on the top right-hand corner of the chat room and select whomever you'd like to chat with. If you need to connect with the tech, if you're having technical issues, or myself, you can start a private chat with the host. And to the right of the chat room, you'll find upcoming events here at eLotus, as well as important information about today's class. All right, and then we're good on that. So the class today is 9 a.m. to 6 p.m. We'll have a 1-hour lunch break from 1 to 2 p.m., 2 short breaks in the morning and 2 in the afternoon. So that's what our plan is going to be. Of course, it is very flexible. And we have 3 groups joining us today, so welcome. The first group is our Watch It Free group. You received a free promotional code to join today's webinar for free. It gives you access to today's webinar only. It does not include the CEUs or 2 weeks video replay, but if you would like to get that, you can upgrade to our second group, which is our paid group. And our paid group, as I mentioned, you do get access to today's webinar. If you attend today's class, you'll get CEUs, and you also get access to the 2-week viewing. And if you want to upgrade from there, we have our third group, which is our Gold Pass members. Gold Pass members have access to all of our online courses for as long as they are members. So it's a 1-year membership, so you get 1-year membership for 1 year access to all our courses, and you get CEUs, and you can watch the videos whenever you want. And as a special treat today, we're going to give you guys a special offer for our Gold Pass members. So stay tuned, look out for your emails, and open your ears. I'll be mentioning it a little bit later today. All right, so if you have any technical issues, such as slowing, skipping, or stopping, and you're on a wireless connection, we do recommend that you sit closer to your router to get a better connection. Or if at all possible, even the better option is to connect to the internet directly. We will try our best to help you with whatever internet provider that you have, and we'll see what we can do from there. If you have any issues, again, send a private chat to the host. All right, so today's webinar is Conquering Type 2 Diabetes Successfully with Acupuncture and Herbs Part 1 with Jimmy Yin. And Jimmy earned his Master of Oriental Medicine degree from Texas Health and Science University in Austin, Texas in 2004. In 2007, he started his private practice and built it into one of the largest clinics in the Austin metro area. Jimmy is an avid student of doctors Jimmy Chang, Richard Tan, and Gui Lizeng. His clinic is focused on quick, effective, and long-lasting results. They practice functional wellness, which is a combination of traditional Chinese medicine, functional medicine, and nutrition. And today he'll be sharing how to successfully conquer diabetes with acupuncture and herbs in his clinic. So let's go ahead and give him a big warm welcome.
Thank you. Excuse me. Is it my microphone? Okay. No? I'm good? Yeah, I'm good. Okay. All right. So today, how many of y'all have actually seen my neuropathy seminar? Any of y'all see it? Anybody online saw my neuropathy? Just curious. Sally? Nice. Awesome. Well, today, I actually have people in the crowd. Last time I didn't have anybody in the crowd, so hopefully y'all can entertain me, okay? Because last time I had to entertain myself. So today we're going to obviously talk about diabetes. Let's see if I can move on. Okay. So I'm going to go over a couple of things. Usually in the beginning, the presenter maybe, go over some basic stuff that may not seem too interesting. But the stuff that I'm going to go over in the beginning is actually very important and very vital, and I'll let you know why that is as I continue. So why am I doing this? Why am I teaching? Why am I sharing all my secrets? My purpose and goal is to help elevate the acupuncture profession around the world by helping you succeed as an acupuncturist. I believe if you can succeed, if all of us can succeed in private practice, then that naturally will elevate our profession. There are some legislative stuffs that we can do in our different states, different countries, but one thing that I strongly believe in is we need to be successful as an acupuncturist. So in order to do that, one of the things is to get results. And so that's what I'm going to be talking about today, how to get great results very quickly. So I want to be able to help you be able to communicate with your patients about type 2 diabetes, produce results of type 2 diabetes tomorrow and not 1 year from now. So like Donna was saying, what I'm going to teach you this weekend, you're going to be able to, if you follow it, you're going to be able to treat your diabetic patients and start getting results pretty quickly. And the last thing, help you be able to help thousands of people get 70 to 80% improvement instead of just one person getting 100% improvement. One of the biggest, I would say, I don't know if it's complaints or feedback that I get for when I'm teaching is the stuff that I teach is too simple. People think it's so simple. It's too simple that how can such a simple system treat a complex disorder or a complex disease and get great results? And so I just encourage you to have an open mind because for me, simplicity is the key. All right, let's move on. So why should you listen to me? Most of y'all, a lot of y'all don't know me, and y'all, don't know anything about me. So one of the things is, three things: results, results, results. That's all that matters. If I can't produce results, you shouldn't listen to me, okay? And hopefully I can communicate to you, the stuff that I do. And we're going to go some case studies tomorrow that show the results, not just based on what I'm saying, but based on lab results, okay? Oh, I'm moving the wrong mouse. Okay. So why is it important to know my story? Another thing that I get is that not patients, but acupuncturists, they may think that you have to study for 20 years, you have to have study under some super master in order to get the great results, in order to learn certain secret things. So it's important to know, at least I think so, it's important for you to know where I got my information. A couple of things, type 2 diabetes, I have a 90% success rate in helping patients reverse their type 2 diabetes. What does that mean, right? That means that if their A1C is out of range, they're technically diagnosed as a diabetic, according to Western medicine, that I'm able to help them get back into the normal range of an A1C. And we'll discuss what that is later, okay? Now, if you may have a question of, I'm going to go back one slide, 2 slides. No? Where's that slide? Oh, I lost it. Well, there was, another slide that said 70 to 80% instead of 90%. I don't know if anybody caught that. But so what's the difference? The difference is the 70, 80% is the results produced by my associates. So when I'm treating it, I get 90%. When my associates utilize my system, they get 70 to 80%. So that's the reason why I said 70, 80%. My hope for you is that you will be able to get the 70, 80%. Because there's going to be some slight differences, but I think 70 to 80% is great. If you can get that with any disorder, you're actually going to be very, very successful, right? Second thing about me is my clinic is the rotation clinic for physicians, physician assistants, nurse practitioners. So physicians, students, and physician assistants, nurse practitioners, they come to our clinics. I have 2 clinics in Austin, Texas, and they come and learn, shadow, and see how we use Chinese medicine to treat different disorders. So medical school, they're starting to open up a little, not a lot, but they do have the option. Like in their last year of residency, they get to choose like 1 month. It's like an elective. They get to choose what specialty they want to go and observe. And I've had a physician choose to come to my clinic to see what we do with Chinese medicine. So I mean, the Western medicine is slowly changing, but it's slow. Let's see, next. So patient visits, just in case y'all were interested. My patient visits, we've gotten up to 188 patient visits per week. For some people that may seem like, oh, that's a lot of people. I didn't do that by myself. Of course, I have associates. I currently have 3 associates that work for me in my 2 clinics. And the 188, it was me and another associate, because I can treat about 140 myself per week. And so I combined functional medicine and Chinese medicine. I didn't get into functional medicine until 2016. But I was treating diabetes before 2016. So you don't necessarily need functional medicine training. And actually, I'm going to train you on what you need in regards to functional medicine to help your diabetic patients this weekend. I'm going to give you every single detail of what I do. I'm not going to leave anything out. There's no other additional course that you need to purchase after this. So you want to pay attention to every single thing. I know some people are on these webinars and they go out and they're just doing something else. You don't want to miss anything, okay? Because I'm not going to waste your time. I'm going to focus just on details. And I do love questions. And my goal is to answer every single question that anybody has. So chat. There it goes. So in the chat, type your questions. The way that I do things is a little different. I do answer everybody's questions, whether it's in the chat or live. Just put it in. This is my latest book. It's called Achieve a Life of Wellness. It took me 3 years to write it, mainly because of procrastination. I actually wrote it probably in less than 6 months, but procrastination of editing it. Am I talking too loud, Allison? No, I'm okay? Okay. Am I talking too fast? Static. If I'm talking too fast, oh, Jai. If I'm talking too fast, just let me know. Okay. Because there's a lot of information to go over, and Sometimes I just ramble. All right. So this latest book is a roadmap. It's a roadmap of what to do. It's not just for diabetes. It's more for a whole lifestyle change. And I wrote this for the general public so that because a lot of people, they're in the public, they're struggling from some chronic disorder, and they got Western medicine, they got functional medicine, they got Chinese medicine, they've got other types, Ayurvedic medicine. It's like, where do I start? They got chiropractic, they got massage. Where do I start? So this is the roadmap to let people know where do they start, which practitioner do they go to seek help for, and where do you go? But it doesn't provide actual, like going over a complete dietary program. So it's more of an outline, a roadmap. I'll be writing more books to have specific solutions, but tomorrow, actually, at the end of the day, I will let y'all know how you can win a free book, and I will send it to you for free if you're interested. All right, mindset is number one. So today I'm going to, yes, we're talking about how to treat diabetes, but a lot of times you have to change your mindset. You have to have the right mindset in order to utilize the strategies that I'm going to teach you today. Because when I start teaching you, you're going to realize, I'm telling you, you're going to think it's so simple. You're like, how can it work? But it does work. You can also check out my YouTube page, AchieveIntegrativeHealth.com. We've got about 90-something video testimonials to show that how what I'm teaching you actually works. Okay, my teaching style, 100% transparency. You can ask me any question. I don't care what question it is, ask me everything, okay? Sometimes my mind is going faster than my mouth, and so I may say something different. So just correct me. Like on the 1-hour webinar, someone corrected me. I said something wrong because I was thinking of something else and I said something else. So let me know if if I say something wrong, okay? It's not intentional. I'm just trying to go super fast. It's going to be facts-based, not theory-based, okay? Simplified, like I said. Opposite of the norm. I do everything opposite of the norm. There's no filler time, no dead space. Answer everybody's questions. You want to hear everything, like I said. So hold your pee and poop, okay? Because you don't want to miss anything. Success mindset, like I said, you want to keep an open mind and focus on the patients and not what you want. I think that's the number one thing. Like I coach acupuncturists around the world, and the number one thing that I tell them is you need to take that focus away from you and what you want and what you think your patient wants, and actually focus on what the patient wants, okay? Because sometimes some diabetic patients, they don't want to reverse their diabetes. It's surprising, but they don't want it. But what do they want? They want more energy. They want to be able to feel their feet. They want to be able to walk. They want to be able to feel the floor. They want to be able to hike, right? So if you keep on focusing on their A1C, and they're like, I just want to feel more energy. I don't care about my A1C. And you keep on focusing your treatments on this, you're going to lose them. They're not going to stay with you, right? In order for us to help patients, they need to stay with us long enough for us to do our magic. And that's probably the number one thing. If you can get anything from me from this weekend, the number one thing that I teach acupuncturists around the world is how to communicate. Communicate with your patients. That's more important than the acupuncture points. That's more important than the herbs that I'm going to go over. Okay? Yes, Amy. Did you take one of my classes? The life effect. Yeah. Okay, how to learn quickly. So you want to commit yourself 100%. So in order to implement my system, one of my coaches says, commitment is 100%. It's not 99.9%. That's not committed. So if you want to get the great results using the system that I'm going to teach you, you have to just block off everything else that you know about diabetes and just implement my system and test it out. I want you to test it out and see if you get the results. If you don't get the results, email me and I'll help you out, okay? But you can't combine two different systems. You can't just go out and go, I learn all 5 things, a functional medicine route of how to treat diabetes, you know, an Ayurvedic route of trying to treat diabetes, a Western medicine route, a dietitian route, and then you try to combine everything, and then my Heal Your Diabetes program, and you try to combine everything all at once. Well, you're not going to get the result because you're not going to know what's causing what, okay? Just a little FYI, I have a biochemistry background, and so I like to do things one at a time, and that's how you're going to see how I do my systems. So number 2, I've already said, remove all other sources, noise, influences. You want to stick with one system and ride it through. Okay, too many cooks in the kitchen, so to speak. And then once you get the result, stop changing it. Just do the same thing. Like when patients, when acupuncturists come and shadow me at my clinic, many of them say, hey, you're doing the same points for every single patient. It may look like it, but and it actually may be, but my intention is not that. It just so happens to be it's the same points. All right, let's go over the outline. And for this weekend. So day 1, facts. We're going to go over facts and current treatments for type 2 diabetes. We're going to go over my clinic's process and patient flow. So basically what happens when a patient, we're going to go over step by step. A patient walks into my office, what do? We do the initial exam, what do we do? What do I say? How do I communicate? How do I do the initial exam? We're going to go through step by step, okay? That's what I'm saying, you don't want to miss anything. Number 3, Heal Your Diabetes program. We're going to go over the exam and diagnostics. We're going to go over what I do in my clinic, okay? You don't have to do exactly some of the diagnostics, but certain parts you want to keep the same. So we're going to go over functional lab analysis. Has anybody had lab training before? Have any of y'all had lab training besides Donna? Okay. Okay, so not a lot of people. Okay, that's all right. I'm going to go over the Cliff Notes version too. I'm not going to, you don't need to know all the details about labs. You just need to know certain parts that can help you communicate better to the patient. All right, and then day 2, tomorrow, we're going to go over the treatments. We're going to go over, actually today we'll go over a little of the herbs already. And then number 3, we'll go over my quick relief acupuncture. The acupuncture, so acupuncture, so diabetes, yes, it takes a while to reverse their A1C, but it doesn't take, it can happen in seconds to decrease their blood sugar, okay, with acupuncture. And there's a way you can test it out. We're going to go over a dietary consultation. So that's a big question that I get asked by acupuncturists is how do you get patients to follow your dietary program? Because if they don't follow your diet, none of this is going to stick, all right? So you need, I would say the number one thing that you need to get your patients to do is to follow your diet. Really it doesn't matter which diet, in a sense. I mean, I'll go over the diet that we go over, but if your patients don't follow your diet, it doesn't matter how much acupuncture, how much herbs you give them, you may help them, but their diabetes will come back, right? It's not solving the problem. That's why you see all those fad diets outside, and they work, but then when the patient stops it, their diabetes comes back, right? So Michelle asked, how long does the blood sugar will stay low? That depends. That depends on each person, and that's why you need to, monitor that. You can test it out with the patient, but we'll go over that when we go over acupuncture. Some diabetics often have vascular disease. Can you use your herbal formulas with Plavix blood thinners? That's a great question. I'm very hesitant when people are on blood thinners, but I still do give patients who are on blood thinners herbs. You just gotta be very careful about the blood movers, right? How do you manage their meds if they take Trulicity or metformin? Do you defer to MD? Amy, I do not. So in the state of Texas, we are not primary care physicians, so we do not talk about meds at all. What I do is I tell them, let's first get your blood sugar under control. Because let me first talk about this. When a patient comes into your clinic, their diabetes is not controlled. even though they're on insulin, even though they're on medication, their blood sugars are fluctuating like this, way too much, right? And so the first step that we do is use Chinese medicine to get that fluctuation from fluctuating like this into fluctuating like this, okay? And I'm just going to give you a little, we'll talk about this later, but the first step of treating diabetes is to decrease the fluctuation. It is not to lower the blood sugar. This is very important. The first step of, I'll repeat it again, the first step of treating diabetes is to decrease the fluctuation of the blood sugar, not to lower the blood sugar. Because the fluctuation in anything, blood pressure, blood sugar, anything, mood, right, is very harmful for the body. And so we want minimal fluctuations. So it's more of a homeostasis, right? So I would rather a diabetic have their blood sugar be at 180, fasting blood sugar at 180, but fluctuate between 170 and 180 versus 180 one day, 100 one day, 180 one day, 90 one day. This stroke, this very bad juju going on, okay? So you need to normalize, you need to decrease the fluctuation. So that's the number one. All right, let's move on. Where am I? So day 2, we'll go over the quick relief acupuncture, the dietary program, dietary consultation. I will walk you through exactly what I say to our patient to communicate our dietary program. And number 5, communications to get patients to follow your recommendations, and creating treatment and care plans. So I highlighted number 5 and 6. That's I would say the most important part of this whole weekend is tomorrow, number 5 and number 6. Remember, the most important part is how do you get your diabetic patient to stick with you for 3 months, a minimum of 3 months to 6 months, right? How do you get them to do that? Because if you can't get them to stay with you for 3 to 6 months, how are you going to reverse their diabetes? It's going to be very, very difficult, right? So that's what I said in the beginning, communication is the key, and that's the biggest thing you're going to learn from me this weekend, all right? All right, let's move on. I don't see any other questions, so let's move on. The facts. Yeah, I know facts are boring, but this is very important in regards to how you communicate with your patients, okay? So 30.3 million people in the U.S. are diabetic. That's 10%, roughly 10% of the U.S. population. 10% of the population are diabetics. They need our help. If weight loss surgery, if medication was working, 10% of the population would not be diabetics, okay? Something is wrong. Our current treatment system for diabetes is not working. How can 10% of our population be diabetics? And another 23.1 million are diagnosed. There should be a 1. 7.2 million are undiagnosed. So another 24% of people with diabetes are undiagnosed. I mean, that's just ridiculous. So really, what is that? 84.1 million adults are pre-diabetic, and that's 34% of our population. So even if you don't specialize in treating diabetes, your patient most likely, what is that? 34%, 1/3 of your patients are going to be pre-diabetic. So you need to learn how to treat diabetes. Whether you use what I teach you this weekend, doesn't matter. You need to learn some way how to treat it. Okay. Let me get a question. Hold on. Oh, no, that's for someone else. Okay. Let's move on. Diabetes was the 7th leading cause of death in the U.S. Okay, we're getting really important information. Total cost of diagnosed diabetes in the U.S. in 2012 was $245 billion. That one's not so important as the next one. Average medical costs for diabetics were $13,700 per year. That's very important for you, for your mindset. Why do you think that's important for you? A diabetic spends roughly $14,000 per year to not reverse their diabetes, but to manage their diabetes. How much do you charge? See, this is more for you. This is not for the patient. I mean, it could be for the patient. This is more for you. When you say that, when a patient tells you that your treatments are too expensive, they're spending $14,000 per year on managing their diabetes. You're going to be able to reverse their diabetes. How much is that worth? That's worth $14,000 per year. They could be saving $14,000, well, minus what you charge. Like, so what I charge for my 3 months programs, we're looking about 3 months, I would say on average, probably around $4,000, okay? That includes everything: acupuncture, herbs, dietary, re-exams, pulse reads. We have an infrared sauna, just other services. But $4,000, and I'm able to reverse their diabetes. So I just saved them $4,000. Actually, I saved them, what is that, 14, so $10,000. So when you think about, this is for your mindset, so I want you to think about when you think that you are charging too much, you're not. Unless you're charging more than $14,000 per year. But then even if you were charging $14,000 per year, you're reversing it. You're not managing it. Managing means that's $14,000 every single year. And how long do they have to pay that? I mean, 10, 20 years. So that's $140,000. Let's say 10 years. That's $140,000, right? I mean, by them spending just $4,000 with you, they're saving $140,000. So I want you to have that confidence that when you're presenting the finances to your patients, I want you to think about this. Think about the mindset that I would recommend you have is you are helping them restore their organ function so that they don't have to spend $14,000 per year. I know I'm spending a lot of time on this, but if you can really get this point, you're set, your goal. Okay? All right, let's see. Yes, and that is out of pocket. That's $14,000 out of pocket with insurance. Okay? So the average medical costs for diabetics were 2.3 times higher than medical costs for people without diabetes. So you're saving them more than $14,000, really. Okay? It is for out of pocket. $14,000 is for out of pocket. Okay. All right, let's go over a little more facts. So according to the National Kidney Foundation, 10 to 40% of type 2 diabetics eventually suffer from kidney failure. And then diabetics have 1.5 times higher chance in having a stroke. See, these are all additional costs beyond the $14,000 if they get a stroke. Javier, $4,000 is to help them reverse their diabetes and teach them how to. So the question is $4,000 treatment every year, is it equal to restoring human body for 1 year, or is it to reverse for life? So it is potentially to reverse for life, because our clinic also gives them the tools, and we teach them how to eat and how to change their lifestyle. So if they continue to implement that, then it is for life. Okay. 50% of diabetics polyneuropathy is, so neuropathy. So those of y'all who didn't see my neuropathy on eLotus, I highly recommend you check it out, because that's the #1 side effect of diabetes, is neuropathy. Okay. This was another from another organization. They said the medical cost was 66. The total annual medical cost for diabetes is $6,632. Yeah, see, these numbers are all different, but you can get my point. Those with diabetic polyneuropathy is 12,000. Severe neuropathy, peripheral neuropathy, they end up spending 30,000. So if they do develop neuropathy with nerve damage, their cost significantly increases because there is no medical treatment to reverse nerve damage. Acupuncture can, but Western medicine, there isn't. And so I highly recommend you go to my webinar on neuropathy to learn how to do that. Okay? All right, let's see. It's high carb. Is the diet you recommend for diabetics high carb or high protein? No. Okay. Complications. I'm going to go through. Okay, so according to the Mayo Clinic, these are the following complications. So these are the things you also have to pay attention to. Even though if a patient comes in to you and just say, hey, I'm diabetic, actually quite a few diabetics are asymptomatic. So when they come in your clinic, they have no symptom, right? Actually, let me rephrase that. Some of them may have no symptom. Most of the diabetics that come into our clinic, they do have symptoms, okay? But some of them don't. Once in a while, you'll get someone that comes in and says, hey, I don't have any symptoms, but I want to reverse my diabetes, right? The key point is you got to figure out why. Why do they walk into your clinic when they don't have symptoms, and why do they want to reverse their diabetes? That's something what I call the life effect. Okay, but complications, heart and blood vessel disease. Heart disease, stroke, hypertension, atherosclerosis, nerve damage, or you talked about neuropathy, extremities, digestion, kidney damage, eye damage, cataracts. So any of y'all that treat eye disorders, you know, really any organ, parts of your body that have these really small capillaries, those are going to be first affected by diabetes. That's why the eyes, all right? That's why the hands and feet, the brain. You get slow healing, hearing impairment, skin conditions, most of y'all know this, sleep apnea, and Alzheimer's disease. So it's the brain. How many capillaries are in your brain, right? Okay. Two of the most severe complications. So these are two that most people don't think about, right? And they're the most important that you need to know. One is the burden on their family. If someone who has diabetic, what is the burden that they have on their family? Let's just talk, you know, let's say they're asymptomatic. It's the financial burden. It's extra expense every single month that they have to pay, right? So what about if they actually have symptoms, that they actually have neuropathy and they can't feel their feet? Well, they can't drive. So guess what? Now they have to be chauffeured everywhere. What about kidney damage? You got to go to dialysis, right? So all of these things, these are the complications that most people don't think about. And the second one is the loss of life. Now, these two are the most important because I talk about life effect. Does anybody know what life effect means? Type it in, please. Life effect. What does life effect mean? Change of life, quality of life. Yes, it's basically how is their diabetes affecting their quality of life? Because patients, I'm going to go on a tangent a little here. The reason why patients come to your clinic for diabetes or for any disorder, it's not because of the disorder. It's not because they're not coming in because they have diabetes. They're not coming in because they have back pain. They're not coming in because they have hypertension. They're not coming to your clinic because they have a migraine. Okay? You may not see this, you may not agree with it, but I would ask your patient. They're coming in because their diabetes is affecting something in their life. It's preventing them from doing something in their life. Okay? Now, in the diabetic situation, this is the reason why I'm listing these two things, the two most severe complications. These two are the two biggest life effects for a diabetic. So the ones that come into your clinic that don't have any symptoms, majority of the time they're coming into your clinic because of the fear of losing their life. Right? But you have to ask them. You have to ask them, why are you here? I understand you have diabetes, and I understand you don't feel any symptoms. You don't feel fatigue. You don't have any slow wound healing. You don't have neuropathy. You don't have any other complications. Why are you in my clinic? I understand you want to get rid of the diabetes, but why? Why do you want to get rid of your diabetes? And some of our patients will tell us, because I want to be here for my grandkids. I don't want to die early and not be here for them. So that's a huge one. Or the second one is the burden on the family. I can't drive anywhere. I feel like I can't do anything, because I can barely even walk without a walker. Like, I have to have someone with me almost all the time. I can't see. The diabetes is affecting my vision. I can't see. So these are the burdens on the family, right? And these are the things that you want to focus on, because that's their goals. That's what they care about. They don't necessarily, they do care about the diabetes, but not so much. If their diabetes was not affecting their quality of life, they would not be in your clinic right now. I guarantee you, they would not. Okay? I had a diabetic patient. She became diabetic because she was taking insulin. But when she first got diabetes, she went to her doctor, and her doctor is like a physician. It's like, this is like in a rural area, in the just rural country area. And so the physician told her, "Oh, did you know if you take insulin, you can eat whatever you want?" And then in 2 years, so she started off with 1 unit of insulin. And then in 2 years, she was up to 50 units of insulin. It was ridiculous. But that's the, the information that people are getting out there. And so, again, my point is, if it's not affecting their daily life, their ability to do something that they love to do, they will not be in your office. So the fact that they actually called your office, because let me ask you this. How many of y'all think that people out in the public, they just one day have nothing to do, and they'll just say, "Hey, why don't I pick up the phone, and why don't I just find a local acupuncturist, and let me call their office and see what they're about?" How many people do that? It takes a lot for a human being to think about, getting poked by acupuncture, to call their office and say, "Hey, I need help." So the fact that they call your office is already telling you they need help. Our job is just not to fuck it up, right? So these two are the two biggest, I would say, life effects that I have found. All right, let's move on. In order to treat diabetes, we need to understand, or any disease, you need to understand what's the definition of that disease. Because we need objective measures, okay? This is one thing about Western medicine. They have objective measures, which is beautiful. In Chinese medicine, we don't have that many objective measures. And so we have to utilize, Western medicine objective measures, because that's what the public has been trained to respond to. So this is according to the Mayo Clinic. When an A1C above 6.5, that equals diabetes. Well, let me ask you this first. Does everybody know what A1C is? Let me ask a different one. Yeah. Does anybody not know what A1C is? Okay. So we all know what fasting blood sugar is, right? Fasting blood sugar is, you haven't eaten for, I think, about 12 hours, and you take your blood sugar. So it's the first blood sugar reading that you have in the morning. Okay? That's what patients can do at home. That is not 100% accurate. And I'll clarify what I mean by that. So it's not accurate because if you ate something, like if you ate something sugary the night before, your blood sugar in the next morning is going to be high. But then if you are good for 1 week, like you eat really good for 1 week, then your fasting blood sugar will be really good. So it fluctuates based on what you eat, right? So it's hard to see, unless you graph it all out, it's hard to see if your blood sugar is doing good or bad. So an A1C, just to simplify everything, I don't want to get into the highly detailed, which some of y'all are, which is great. But the A1C is the average fasting blood sugar for the past 3 months. So it tells you for the past 3 months, how is your blood sugar doing on average, okay? That is the most accurate blood test right now. And so if you're treating diabetes, you want to get that number, okay? If you, like, there's some patients that just don't want to go to a doctor's office, and there are, right? You can have them do their fasting blood sugar, but you have to graph it out. And we do that in our clinic. We'll graph it, put it on, if we use Excel, you can graph it out, and it can show you trends. You can draw a trend line, and you can see if the blood sugar is going down, or if it's going up, or if it's staying the same. Okay? All right, so that's what A1C is. So A1C above a 6.5 means you're diabetic, according to the Mayo Clinic. And if it's between 5.7 to 6.4, it's pre-diabetic. And if it's below 5.7, you're considered normal, right? Are these averages really accurate? I have no idea. This is just what the Western medicine uses, and so we follow that. We use that system. Okay. With the type 2 diabetes, your body either resists the effects of insulin, which is called insulin resistance, or doesn't produce enough insulin to maintain normal glucose levels. So that's the definition of type 2 diabetes, okay? So the term insulin resistance is the one that most people are familiar with, all right? So we're gonna base our discussion based off of this. Okay. Any questions? Amy shouts. Yeah, there's multiple apps that you don't even have to do in Excel. They have apps. There's so many free apps on the phone that you can track your blood sugar and they can graph it out. All right, so you don't have to do that. All right, no questions. All right, something to ponder. So I'll have a couple of these slides because I want you to remember mindset is the #1 thing that in order to communicate better, you have to shift your mindset. So the first thing is it more important for you to know all the scientific language and research about diabetes, or is it more important to know how to get results for your patients? Is it #1 or #2? Two. Yes. I know, it's kind of an obvious question, right? But I put this here so we can focus our mindset, because I could bore you with all the details, the scientific details about diabetes, but that's not going to get us closer to helping you reverse your patient's diabetes. Okay, so you'll notice that I try to keep things simple, and most of the way that I'm communicating to you is exactly how I communicate to my patients, very layman terms, because that's what people understand. Okay. Okay, normal blood sugar and metabolism. So for those of y'all who are not sure or not familiar with what goes on in the body, let me see if I can do an arrow. Nope. Oh, they do see what I'm pointing at?
Yeah, with your mouse.
Oh, okay. Oh, yeah, sure. Duh. Okay, yeah, let's start with, okay, we all know the pancreas is involved with blood sugar, right? So the pancreas secretes insulin, right? So let's go. So we'll start up here. So high blood sugar, right? If your blood sugar is too high, your pancreas produces insulin. Insulin causes this graph promotes insulin release in the pancreas. And insulin stimulates or glycogen. I think some of this is wrong. I'll verbally tell you. So if you have high blood sugar, it stimulates your pancreas to secrete insulin. Insulin is like the lock and key to help the blood sugar go from your blood into your cells, right? Actually, I will draw. I'm going to test out this cool thing. They got this cool little whiteboard thing. I want to test it out. Okay. So here's your pancreas. Okay. What about the width's good enough. Red is good. All right, pancreas secretes insulin. Is this on the screen? Yeah, okay, cool. Which, here's your cell. So this is an insulin receptor. Insulin receptor. Here's insulin. Okay? And then let's put a door. This is a door right here. Door. All right, sugar door. Sugar door. Sugar door. Glucose. This is sugar door. Same thing. Okay, so the insulin, okay, when the blood sugar is too high, high blood sugar, causes the pancreas to secrete insulin. Insulin comes in, attaches to the cell right here, okay, and then it opens up this door. So when it attaches, insulin attaches right here. Bam, it attaches, and then it opens up this door. This is sugar particles, glucose. I'll just write sugar. It allows it to come into the cell. Okay, that's how your body normally should work. All right. When you have too much blood sugar, like after you eat, this is what happens. Okay. Now, what happens when it's insulin? Let me see if I can change. I'll change the color. What is insulin resistance? Actually, let me go here. Insulin resistance is when the receptor gets warped. Okay? So now you see how this lock and key, they don't fit. And if they don't fit, it doesn't fit, it's not going to open this door right here. Does that make sense? Yep. Pretty simple, right? Anybody not understand what I just said? Okay, everybody understands. Awesome. I can get out of this. Oops. Can I keep it? Can I keep? Oops.
Yeah. You want to keep it?
Yeah, but go back to the other.
Yeah. We'll keep it. Just the eyes here. The eye.
Oh, just click the eye. Okay, perfect. I'll keep it and I'll come back so I don't have to redraw it. All right, and okay, so another thing that happens is breakdown of glycogen. All right, I'm just gonna. This slide is a little off, so I'm gonna draw everything. So another thing that happens when your blood sugar is way too high is your liver. So high blood sugar, liver stores sugar as glycogen. You don't really need to know all these terms. Just know that, again, because your patient is not going to know what this means, okay? So what you just need to tell them is that your liver stores sugar too. And if it stores too much sugar, it's going to get fatty, okay? So if you got a fat liver, you got too much sugar. And actually, a good example, everybody knows alcohol damages the liver, right? Why does alcohol damage your liver? Does anybody know? Alcohol is just a sugar. Yeah, it's just alcohol is what I call sugar with a buzz. That's the difference. The difference between, you know, regular like table sugar and alcohol. Yes.
Are you referring to all alcohol?
Yes, all alcohol. So the question was, am I referring to all alcohol? Yes, all alcohol. You drink enough of any alcohol, it's going to damage your liver. Don't try it out. Take my word for it, okay? So you're going to damage your liver. So the same thing if you eat a lot of processed sugar, you're going to damage your liver too. So the difference is you don't get that buzz when you're eating regular sugar, right? And for those of y'all, go onto YouTube. There was I talked about this in the one hour webinar. It's Sugar, the Bitter Truth. Sugar, the Bitter Truth. Okay, it's a presentation by a University of California, San Diego medical doctor. And he talks about this, okay? So sugar is actually the worst drug than any other drugs, right? And so he talks about this. So check it out. It's about an hour, you know, presentation. All right. Now, okay, does everybody understand this? Because I'm about to erase this.
Do you want to save it?
I can save it?
Yeah.
Oh, I can save it. Hold on. I'll take a picture.
Yeah, basically tell a little bit to save. So later with the desktop,
Okay, cool.
we can bring it back.
Can I ask a question?
Yes, question.
Insulin resistance,
Yes,
the gate or the door is shut.
yes.
And the ultimate question is, will Chinese medicine integrative approaches
Mm-hmm.
help to open that gate? Because right now in Western medicine, guidance is the only thing that opens up that gate for insulin resistance, and it helps it to channel through, and therefore the other benefit is protecting the heart.
Mm-hmm.
The other thing is also genovia.
Mm-hmm.
So, but it's very, very costly.
Yes.
So, do we have anything that would assist, you know, the opening of the gate, not the gate, but to help it to walk through?
Yes. To allow this. Okay. So the question, I have to repeat the questions, right, Sam? Okay. So let me. The question was, is there anything in Chinese medicine that can help us I'm going to summarize her question. Resensitize the insulin receptors so that it allows the sugar to go from the blood into the cells, instead of, you know, the medications that she was talking about, Jardiance, Januvia. So the answer is yes. Chinese medicine, Chinese herbs can resensitize the insulin receptors to allow the lock and key to actually work and open up the door for the blood sugar to go in. Now, how do we do that? And I think there was another question here is, the receptor cell is so right here, the receptors are warped, right? This green right here. So the question is, in order to solve a problem, you need to know what caused the problem. So what caused the receptor to be warped?
Exactly.
That's the key, right? That's the magic, you know, the secret answer, the secret question. So the biggest thing that causes that warp is inflammation. Okay? So I'll write here, I'll write it in green.
Correct. So the point, actually the question that I have is how do we manage the inflammation? Because not everybody has inflammation, therefore not everybody is type 2 diabetic condition, even though my family has 4 generations of it. So I think that the root before, like you said, to diabetic resistance would be where did the inflammation come from?
Yeah. So the question was, if there's a family history of diabetics, and some have
Especially
Asians, and some have more inflammation. We all have. Let me answer one thing. We all have inflammation somewhere in our body, just different parts of our body. Why are some people have the inflammation on their insulin receptors to warp it, and some don't, right? The reason why is, I believe, it always comes to lifestyle. Okay, there's some genetic component to it. There's a genetic component to every disorder in the world. Okay, but why are some people, why do some people get diabetes and others don't, even though they're genetically predisposed? So it always comes to lifestyle. One of my mentors told me lifestyle always trumps genetics, always, right? So is it fair? No, it's not fair. Some people just have to work at it harder than other people. That's just life. So I would say the root cause is genetics. I'm not genetics, lifestyle. Let me right here. So if we're backtracking, so we want to backtrack. What caused what? This caused this caused this, to get to the final first root, right? So the first root is lifestyle. That's for everybody. And that's the number one thing. Then lifestyle generates what I call the second root, which is organ dysfunction. And this is where Chinese medicine comes into play, okay? So, but let me finish this point first. Actually, let me write this sorry. Oh, crap. Did I just delete the whole thing?
You want?
No, that's all right. I wanted a white screen too. That's right. All right, let's start again. So let's say, yeah, exactly. That's how you get diabetes. You just click the eraser button. That's how you get rid of it. All right, so let's say etiology. Now, let's use simple terms. Delete. Cause of diabetes. So I said the first one was lifestyle. This is not just dietary. This is, so one thing I learned from functional medicine is what we call the 3 stresses, okay? So 3 stresses. Does anybody know what I'm talking about? 3 stresses in life. 3 stresses, anybody know? Nobody knows? Okay, I'll write it here.
Physical, emotion.
Yes, some people. Dr. Kareem, yep.
I have a top student in here.
Yes. She's heard me say it too many times. Physical, chemical, emotional. So this is what you will hear from every functional medicine practitioner. This is how, when they do talks outside, dinner talks, workshops, they always talk about the 3 stresses. So physical stress. Physical stress is if you've exerted yourself, you too much exercise, too much or lack of exercise, or you're doing way too much beyond your body's capability, okay? So that's one thing. Chemical stress is anything you put in your mouth. So if you put the wrong things, if you put crap in your mouth, guess what's going to happen, right? Besides crap coming out the other end, okay? You're going to get crap in your body. So that's pollution also, like breathing. That's chemical too. So if you're like, I'm from Taiwan, And Taiwan has terrible pollution. And I heard Beijing has even worse than Taiwan. And so if you're breathing in that stuff, you're getting chemical poisoning. Okay? That's a chemical stress on your body. That's changing the physiology of your body. Okay? That's why you see on TVs and the Asian, they all wear these masks because they're trying not to suck up all that pollution. And food, dietary. Dietary obviously is what you put in your mouth. Medications. Medications cause diabetes, right? So that's chemical. This is all chemical. So you have to look at that too. And the last one is emotional. Emotional, and we'll talk about this a little later, because you can actually have, you could be perfectly physically fit, you could eat the perfect diet, but you could still have type 2 diabetes because of this third stress, emotional stress. And you could be thin as a rail, and you could still be type 2 diabetic, okay, because of this third stress. So this is the root cause, okay? Then, now we're going to go forward, okay, because we know that inflammation causes the insulin resistance. But what's before that, right? So we know number two I said, is organ dysfunction. Organ dysfunction. Does everybody know what that means? Organ dysfunction. Do y'all know what that means? Organ dysfunction? Anybody know what I mean by organ dysfunction? It's not a trick question.
It's not working properly.
Exactly. The organ's not working properly. So every organ, let's just say, has 10 functions, right? The ones that are only doing 8, 7, 6, 9 of their functions is not working properly. Because let me ask you a question. When should your heart ever stop beating? When you're dead, right? So it needs to be doing all of its functions all the time. It doesn't choose, oh, hey, I'm only going to do option number 1, 2, 3 today, and I'm not going to do 4, 5, and 6, right? So the key is finding out which organ dysfunction. Now, what tools do we have to use to find out organ dysfunction? I don't care if it's Chinese medicine, I don't care if it's Western medicine. What tools do we have?
Tongue and pulse.
We have tongue and pulse. So Chinese medicine, we have tongue and pulse. What else? We've got blood work. Yes, from Western medicine, we've got blood work. Blood labs. What else? What else do y'all use in your clinic?
Observation, listening.
But how someone said observation and listening, how does that help you determine which organs are dysfunctioning? So we're thinking about, what do we do to figure out organ dysfunction? Was the face?
Yeah.
Facial diagnosis? Yeah? Palpation, differential you could do, yes, you could do differential diagnosis. So that what you were talking about, the symptoms. So asking, right? So I would say asking. What else? What else does everybody do? How do you diagnose your patients when you're in your clinic?
The intake.
Yeah, so that's the asking. So that's the differential. Auricular, yep. Auricular. Looking. Looking at what? Electrodermal screening, yes.
I don't know, but for me, mental and emotional state I can observe quite clearly
Mm-hmm.
because I do life coaching. So
You cannot observe, or you
I
can?
can.
You can, okay.
Yes.
So that's
They-
observation, right?
the demeanor and
Okay.
what they choose to hold back or not hold back, which usually tells there's a lot of stuff going on underneath what they're just telling you.
Okay, hold on.
From there you can probe.
Let me write all this down. This is all
For
very
auricular, you mean observation?
Yeah.
Okay.
Electrodermal. Let me write this. What else is there? Looking at the skin. Yep. So, pencil. Yeah, I'll say observation of their skin, of their emotion, of their demeanor. I'll put that all under observation.
It's under the three stressors.
Yes. What else? Auscultation, hearing, of movement. Yep. That's observation, so that's more observation. Allison, I'm trying to repeat what they're saying. So, what the audience is saying. Body physiques. Okay. So we've got, you can see we've got tons of ways of from Chinese medicine. And look at Western medicine. Oops. We've got blood labs. What else? There actually are other stuff in Western medicine.
X-ray.
Yes. Let me write. Imaging. That will sum up everything. Okay. EP, yeah. So vitals.
Dietetics.
That's, you mean like questioning? Dietetics?
Dietetics, no, in Western medicine, they send you to a dietitian to learn how to eat when you have a diabetic patient. Western medicine.
Yes, that's the treatment. We're talking about how do you find out what's wrong with your organ. Which organ is dysfunctioning?
Electrophysiology.
Yes? Kind of like, you're talking about like EEGs?
Yeah, something like a
Yeah.
EMG, EEG.
Yeah, EEGs, EKGs, EMGs for nerve. Yeah, that's, yes. So we can do that. Anything else? DNA, that's part of blood test. We'll just include that in part of blood test. What about
Biopsy.
Testing the nerves.
what do you mean testing the nerves
I'm not sure what they do, but like.
for neuropathy? Yeah, that's part of the EMG and the NCV. Those are nerve conduction tests. Okay. What about urine tests? Right? Urine. What about saliva testing? Right? So it's not just blood. We can do urine, saliva, physical exams. Yes, Allison. So physical exams.
DNA, biopsy.
Yeah, someone said DNA, so I put that under blood. Physical exams. Okay. All right. So eye exam, palpation. Yes. That's part of the physical exams. Palpation. Palpation is part of physical exams. Eye exams. You can do eye exams. All right, good. So here's my point. We need to use these tools that we just I just wrote down, to use these tools to help us find which organs are dysfunctioning. That's the key, right? So we know let's go back. Number one, the lifestyle, the three stresses. But what the three stresses are causing what? Which organs to dysfunction? That's step two. Step two is figuring out what these three stresses are causing which organs to dysfunction. We can use Western medicine and we can use Chinese medicine diagnostics. Now, Chinese medicine diagnostics, why would we have so many Chinese medicine diagnostic techniques. Why do we even need Western medicine diagnostics? To complement?
See the results, progress.
So yes, to see the progress. Because I kind of gave you the answer before, because patients, they don't know anything about Chinese medicine diagnosis at all. They don't believe in it because it's mystical to them. What do they believe in? They believe in blood labs. They believe in imaging. It's evidence-based, right? Well, so-called evidence-based, right? They believe in that type So we need to use those. Yes, it's more objective measures. Those are classified as objective measures. Those can help us as acupuncturists, but I use them mostly for the patients so they can see that they're progressing. But my treatments are not based necessarily, I would say majority, 90% of my treatments are not based off of Western medicine diagnostics. It's based off of Chinese medicine diagnostics, okay? But I use Western medicine diagnostics in order to communicate to my patient so that they stick with the treatments. And see the end results, as one person said, okay? So what's the third thing? Let me see. Any questions about what I said? Nope, okay. So number 3, that's where we get to the inflammation. Or you could say blood circulation problem. Blood circ prob. Okay, so bam, bam. So we find out which, we know it's the 3 stresses, and we identify what are they doing wrong. What are they doing wrong from the physical perspective? Are they exercising too much? Like some people who do CrossFit. If you want, on a side note, if you want to get more, if you like to treat pain and you want to get more new patients, go talk to a CrossFit gym. They got tons of people getting injured, okay? But we need to figure out, are they, what are they doing wrong on a lifestyle, on a daily basis? Like, are they lifting stuff without, if their job is to lift tons of stuff, 50 pounds or more without with no support, or they're not taught how to lift those things, then we need to educate them about that, right? So that's the physical part. Chemical part, we need to go over their diet. We need to, even though we don't discuss their medication, we need to understand their medication so that we can communicate with them about what their medication is doing. Because most of the physicians don't tell their patients what the medication does to their body. They just say, hey, take it. It's going to help your blood sugar, okay? So we need to know what's coming in. We need to know, are they exposed to toxins? Are they breathing in stuff? Do they work in a chemical plant? Or do they work in an environment where there's a lot of pollution? We need to know that. So we need to help them identify these things. This may seem so simple to us, but it's not simple to the average person, okay? And the last one, emotional. What's going on? Is there, their family, pissing them off? Their kids, driving them crazy, or their work, whatever. We can't change those things, but we can be there to listen and help them to identify maybe possible solutions. So that's starting from step 1. Okay. Then, so that's the permanent fix. The permanent fix is to help them with the physical, chemical, and emotional part. Okay. And number 2 is then we need to help them get their blood sugar back into regular balance. So then we have to look at which organs are dysfunctioning. We can use the TCM diagnostics, and we utilize the Western medicine, okay? Then we know step 3 is because of the inflammation. That organ dysfunction causes inflammation. Does everybody understand how that happens? Does everybody understand how organ dysfunction can cause inflammation or circulation problems? Okay, so no. So let's think, let me use very simple. We need to eat and we need to poop every day, right? If we don't eat, what happens? Yeah, we don't poop. When we don't eat, we don't poop. But yes, if we don't eat, what else happens? You don't have energy, you shrivel up, right? And if you don't poop, let's say you don't poop for 1 month, how are you going to feel? Besides like crap. You're going to be retaining a lot of toxins, right? So every organ in your body needs the exact same thing. They need to eat, they need to poop. And so if they don't eat and poop, that creates inflammation, right? Because if you don't eat, it generates inflammation because your body will have to try to respond, adapt to a different homeostasis. And it causes other chemical reactions. And you're not providing it with nutrition for it to have normal reactions. So chaos ensues. Okay, so I would say blood circulation problems. And then if you don't poop, you accumulate. So inflammation, I like to define as, what does inflammation mean? What is the definition of inflammation? I know we're getting technical here, but this is actually very important when you explain acupuncture. The question is, what does inflammation mean? How do you define, what does it mean? A patient asks you, what do you mean, what's inflammation?
You mean in Western medicine terms?
It doesn't matter, any terms. I would say in a patient, how are you going to communicate to a patient, what does inflammation mean?
I tell my patients that the body's on overload and it's really angry.
Okay, so she said that the body's on overload and the body's really angry. What else? How would you communicate inflammation to someone, to a layperson?
The white blood cell attack the body.
The what?
The white blood cell.
The white blood cell attacks the body? Okay, that's one way.
And then it explodes.
And then it explodes. Okay.
People don't know what's white blood cell already.
Yeah, exactly.
To make it simple.
Yes, stagnation.
Yeah.
But how do people understand stagnation?
Things not flowing properly. Like
Things not flowing properly, like circulation.
Being stuck.
Being stuck? Yes. Okay. So the way I define inflammation to my patients is retention of waste. And then I tell them, what happens when you don't poop for 1 month? You retain a lot of poop in your body, right? That's a lot of waste. That causes inflammation. Yes, inflammation is swelling, redness, and heat. Yes, that all makes sense. Okay? So when your organs dysfunction, if they're not eating enough, they're going to malfunction. And if they're not eliminating waste, they accumulate waste, which generates inflammation. And inflammation, is it acidic or alkaline? Acidic, right? When you pour battery acid on something, what happens to that something? You pour battery acid on this pen, what happens to the pen? It erodes, yeah. Yes, right? It basically almost melts it, right? So what happens if our bodies are acidic? What happens to our cells? Yes. So, let's see. So does that make sense? If the acidity gets to the insulin receptors, it's just like, the door, you try the key knob, you pour some battery acid into it, you change the shape of the key knob, the key hole, right? And so your key, which was the right key for that specific lock, it doesn't work anymore. Does that make sense? So yes, that's probably the best analogy, is pouring battery acid on your doorknob in your keyhole. It warps the keyhole. You have the right key. It's not that you don't have the right key. You have the right key. It's just now the receptor has changed shapes. So you can't open the door. So you can't open the door to allow sugar to go into your cells. Does that make sense? So that's basically how I would explain, because some patients will say, yeah, I have insulin resistance. What does insulin resistance mean? That's how I explain it. Insulin resistance means that you have the right key, but your keyhole has been warped and you can no longer open the door. You need to open the door to allow sugar to go into your cells. Okay. Let's save this. Oops. There we go. Perfect. Let's see, Okay. All right. I know we're spending a little more time on this, but this is important because you need to know how to explain this to your patients. Remember, The key is how to communicate to your patients so that they are able to understand what you're trying to do, okay, so that they stay around long enough for you to treat them, right? All right, let me answer a question. Are you saying too much exercise is a cause for diabetes? I'm not saying it is, I'm saying it could be, okay? If you exercise too much to the point that you're damaging, let's say, too much exercise usually damages the adrenal glands. And if you're, I'll go off a little tangent here, but if you damage your adrenal glands, you will have diabetes. I mean, you could have diabetes, not your will, but you could. So you have adrenal glands. So too much exercise. Now this is a case-by-case scenario. You know, some people can exercise more than others. Their body can tolerate more. Creates a physical stress. Remember about those 3 stresses? So this is the physical stress. Which damages the liver. Because we know in Chinese medicine, the liver helps us manage our stress, but also the adrenal glands do too. So the adrenal glands, so too much exercise causes physical stress, damages the liver and adrenal glands, and the liver stores sugar as glycogen. So if the liver is not doing its function, it could be releasing sugar into the blood. So liver can release sugar into the blood. Release sugar. And also the adrenal glands, AG, secrete something called cortisol, which causes sugar to go into the bloodstream. Into bloodstream. To blood. So when that happens for a long period of time, then, so you've got your liver, so you've got 2 organs secreting sugar into your blood just because you're overstressing, physical stressing your body, okay? So you've got 2 organs, the liver breaking down glycogen, which is stored sugar, and it releases into the blood, and then you got your adrenal glands, which secretes cortisol. Cortisol is a stress hormone. Does everybody know stress hormones? Right? So cortisol is a stress hormone. It's released based on some physical, chemical, emotional stress, stressing your adrenal glands out. But that causes a rise in blood sugar. Okay, and this is actually the adrenal gland one. This is the main cause of like you see the people that are super skinny and they're diabetic. It's because of stress, okay? Because remember, it doesn't have to be just physical stress. It could be emotional stress. Am I writing too small? Okay, I'll write bigger.
So you're saying cortisol releases sugar?
Yes, cortisol causes sugar to flood the bloodstream. So if you're constantly stressed, then you're constantly secreting cortisol and you're constantly putting sugar in your blood. So the adrenal glands are so.
Or that's the energy, like the adrenal.
Yes, yes.
Okay.
So the question is why. The question is why. Why the sugar goes in? Why does cortisol cause sugar to go into the blood? So the adrenal glands help us. They basically, I would say, help. They control our fight or flight reaction, our sympathetic response, right? So the adrenal glands also secrete adrenaline, right? And so when you're stressed, your body stresses the adrenal glands, which causes your body to go into that fight or flight. So if you're in that fight or flight, like a dog's trying to bite you in the ass, you're running. What do you need more of? You need more energy, right? So that's why when your adrenal glands secrete cortisol, the other reaction that's happening is the body diverts blood away from your GI, your gut, and puts more blood to your muscles, right? but it needs more sugar in the muscle so it can run away from the dog that's biting them, right? And that's the same reason why your digestion will go down, right? Hopefully this is all making sense. All right, let's move on. Oh, let me talk about the liver. So the liver, I think I finished the liver. Let me see, let me get out of this. Okay, let's see. Promotes glucagon release. Glucagon stimulates breakdown of glycogen. That's if the blood sugar is too low. This graph is wrong. I'm sorry. Disregard this graph. Okay. So if this blood sugar is too low, then the pancreas. Oh, actually no, it's going this way. Some of it's right. Sorry, I just didn't draw it completely great. It can be misleading. So if the blood sugar is too low, it promotes the release of glucagon, which is released by the pancreas, which stimulates the liver to release, to break down glycogen into sugar, and that will raise blood sugar. Okay. Stimulates blood glucose uptake. Yeah, and insulin causes the cells. Insulin opens up the key to the door to allow sugar to go from the blood into the cells, and which lowers blood sugar. Yeah. Sorry about that, guys. Hopefully I didn't confuse everybody. Okay. All right, let's move on. Oops. Oh, this is the next one. Okay. So causes of type 2 diabetes. According to the Mayo Clinic, diabetes is not a curable disease. And I'm not saying it's curable. Okay. Disclaimer. I'm not saying you're going to cure diabetes. No one can say that. Okay. I'm just saying that you can help restore their organ function, and their bodies, actually what I'm saying is their bodies can cure diabetes. I can't cure it, you can't cure it, but their bodies can. We can just provide the correct environment for their bodies to cure it themselves. All right, diabetes and type 2 diabetes develops when the body becomes resistant to insulin or when the pancreas is unable to produce enough insulin. Exactly why this happens is unknown, although genetics and environmental factors such as being overweight, inactive. See, this is what Western medicine thinks. But also Western medicine, if we're talking about evidence-based, Western medicine is coming out with more evidence of inflammation. Inflammation, warping. I'm just saying it's warping. I mean, there's actually a specific chemical structure that changes on the receptors of the insulin, but just for our purposes, and I like to communicate in a more easy, simple way, it's warping the receptors, okay? Let's see. Okay. Actually, here it is. I did include it. It's called hematopoietic-derived galactin-3, causes cellular and systemic insulin resistance. Here's the link. So you can go to this link. This will actually show you from a chemical standpoint how it's warping the insulin receptors, if you're interested in that stuff. All right, current treatments for diabetes. So what does Western medicine have to treat diabetes? It's all these. Actually, it's not to treat diabetes. Their word is manage diabetes. They don't treat diabetes, okay? So there you go, weight loss. That's why you have those bariatric surgery. The bariatric surgery, those basically, there's different types. Does everybody know what bariatric surgery is? No? Okay. So bariatric surgery, there's many types. But to simplify it, basically they cut their stomach, right? They shrink their stomach and to like a little pouch, okay? The patients lose a ton of weight really fast. And they say that they cure their diabetes because their diabetes instantly goes away. I mean, not instantly, but it goes away really quick, right? And so once they lose the weight, they are no longer diabetics. But here's the problem. The problem is after they start eating back to normal, it all comes back. Their weight comes back, actually worse, because I've treated patients with like stomach sleeves. There's called a Roux-en-Y, bariatric surgery. So all of these, they gain the weight 2 times as much, all right? And their diabetes comes back. So it's not cured. Okay. Martina, will we get formulas to flush out liver? Something similar to Xiao Yao San or jumping ahead, but name one today, please. Yeah, I mean, the way that I prescribe herbs is very different. But yeah, there's so many different formulas. Longdan Xiegan Tang can do it. Chai Hu, Qinggan Tang, liver detox, evergreens liver detox can do it. There's many. I mean, Xiao Yao San can do it, depending on the, the way that we do it is depending on the pulse. Okay. Yeah. So there's many ways to help flush out the liver. All right, let's continue this. So in Western medicine, they have healthy eating, but their healthy eating is different. Their dietitian program is completely different, right? And what are the popular dietary programs right now that y'all have heard of that are, people using to lose weight and to reverse diabetes? Like, what's common right now?
South Beach diet.
South Beach diet. Okay. What else?
Keto.
Keto is the newest one. Paleo, right? Have any of y'all used that on your patients? No. No? Use it yourself? The paleo?
Paleo and keto.
I think it's low carb, high protein, and balance.
Yeah, low carb, high protein, balance type of, right? All those diets work. They're not necessarily sustainable for long term, but they all work. I would say most of these diets, they work initially, but the key that you have to think about is that diet really helping you restore your organ function? Because remember that I told you the causes, right? So the first step, so let me see if I can find that slide. Sam, how do I get to the save slide?
Yeah.
Do I go here?
So, this slides is in the desktop now.
Oh, okay.
So let me do that. You kind of have to like use a keyboard.
Oh, okay.
Here, which one you want to go? You have 2 here.
Let's see. No, not that one.
Okay, this one.
Yes, this one.
Okay, let me see if you can just expand it so they can see it right there.
Okay, perfect. So coming back here, this is one probably very important slide because this will tell you how to basically using this you're going to reverse the diabetes. Okay, so the diet we know that the insulin resistance is because of the warping of the cellular receptor the insulin receptors. That warping is caused by inflammation. So we have to decrease the inflammation using the diet, right? So what diets can decrease the inflammation? Does anybody know? And we know that the inflammation causes acidity.
Ones that avoid sugar.
Yeah, ones that avoid sugar. What'd you say?
No, reduce the acidity or balance your pH factor, your alkaline.
But how? So she's saying reduce acidity.
Food that we eat, citrus. I don't eat so much citrus.
Mm-hmm.
Take more of the foods that are like melons and stuff.
Okay, so we have to get a diet that is neutralizing that. Yeah, so Allison, yes, anti-inflammatory diet, alkaline diet, those are great for reversing the inflammation. And then we have to look at, the second cause. The second cause is the organ dysfunction. So then we need to have a diet that addresses the organ dysfunction. So which diets help restore the organ function? Cut back on grains, good fats. Yeah, y'all are all right. Juicing can help. So this is the thinking process. I'm trying to teach you the thinking process of how I developed my program. Okay, so because we already know the causes. This is the cause. This sheet you need to just plaster on your wall and figure out. Then you got to figure out what tools can you use to start reversing from step 3, step 2, and then back to step 1. So we go backwards. If you help step 3, you help step 2, and then you teach them how to step 1, and that's how you can teach them, give them the tools where they can maintain it by themselves without you. That's the key. That's what we do in our clinic. Whether you want to do that or not, that's up to you, but that's how we do it in our clinic. Okay? So let me get out of this. Go back to here. Go back to here.
Julianne,
Yes.
I'm curious, are we gonna go over the emotional stressor, like more in depth?
What do you mean by emotional stressor?
Like anything in particular that's related to that? Like as far as their approach to themselves or life or whatever, stuff like that?
So the question was, are we going to go into more of the emotional aspect?
I mean, I know it's related to digestives, like spleen, stomach, like support for themselves, stuff like that, but
Do you mean if like what the emotional aspect affects in their organs?
more specific of like what type of emotional stressor, or like if it's all, you're just saying all emotional stress?
Yeah, we're not. So the question is, are we going to go into a specific type of emotional stressors? No. So because all of the different types of emotions, whether it's sadness, whether it's extreme sadness, depression, anxiety. Actually, we might go into some detail. It's based off. It's more. They all affect certain organs,
Right.
but not consistently. The way we do it is we feel the pulse, and the pulse will tell us exactly what organ the emotional stress affected, regardless of if it's anxiety, depression. And actually from the pulse that I'm going to teach y'all, you can tell if the patient is more anxious or more depressed. So you actually will be able to tell the patient. You don't really need them to tell you that, right? So we'll go over that. Yes?
Can I offer a little, my method?
Yes, please.
Because I deal with a lot of that.
Oh, hold on. We got a mic here.
I deal with a lot of those stressors.
So we have someone who deals with a lot with emotional stress.
Because I
She's
do
gonna
coaching. Yeah, it doesn't matter what they're stressed about; they are stressed, and you have to build an element of trust between you and the patient.
Yes.
And then they are open to sharing,
Yes.
and they will unload, a ton of stuff, which
Yes.
you have to narrow down.
Yes.
And I ask them, which is the one out of the 10 things that irritate you and occupy most of your thinking time?
Yes.
And they will identify. I said, well, I can't. I said, well, then pick 3.
Yeah.
And for me, the secret is homework. I give very basic assignments that they are not graded. That's the tool. And they go home
Yeah.
and they work on the assignment.
Yeah.
Very simple.
Yeah.
What is it? And then they bring it back.
Yeah.
Some of them would say, oh, I can't think of it. And that gives me the idea that they're not even able to face it.
Yeah.
But they
yeah.
know, but it's there, and they know it's there. They
Yeah.
can, and that's where you as a practitioner can help walk them through
Yes.
based on the previous visit.
Yes.
And then once they identify it, I help them to cancel out that list
Yeah.
one by one. And then we have a celebration
Yeah.
of getting rid of that thing.
Yeah.
Yay. But then it will come back into your head
Yeah.
and say, this is haunting me again.
Yeah.
And then they have evidence-based. I was here on this visit, my Stella with me,
Yeah.
and we checked this list off, and it is GONE. But it's talking to me, and that's
Yeah.
all dialogue
Yeah.
that should not be there and does not exist.
Yeah.
And one by one, they are being addressed.
Yeah. That's good. No,
Yeah.
that is really good. So, and what you just said, if I can just summarize what she just said, I mean, you just really emphasized the importance of communication. How you communicate to your patient will determine what type of information they're going to give you, right? And so it takes practice. Like I train my associates, we have scripts that we say to elicit the certain response. And what you just said is it's very similar to what I would describe as the life effect, right? How their emotional life effect, right? And so, you need that information. So this acupuncturist, what she just said, you have to have that information, because if you don't have that information and emotional stress is the cause of their diabetes, you can temporarily restore their blood sugar metabolism, but they still have that emotional stress. You didn't fix the root, the diabetes is going to come back, right? So that's why, in that slide that I just showed you, you have to first address the inflammation, and then you have to address the organ dysfunction, and to really fix the root cause, you got to address all of those three stresses. So that's why it takes 3 to 6 months, at least. It's not like, 1 month and oh wow, magical, praise the Lord, it's gone, my diabetes is gone.
But the scariest part is that by the end of X amount of weeks, you have to be willing to recognize that there are some patients that don't want to be healed.
Yeah, so she was saying that some patients don't want, especially from emotional, they don't want to be healed. They like that suffering, right? And yes, that is. And that's why you have to get very clear as to what their goals are. Because their goal, even though they're struggling with certain emotional stress, they may not want to get rid of it. And it's not for us to say that they should get rid of it. So you see, this is when I said in the very beginning, the focus needs to be on the patient and not on what we think. It's about what the patient wants, not what we think they want, right? So that's very key. Yes. All right, let's continue. So Western medicine says healthy eating, right? But that's so vague. Regular exercise and diabetes medications or insulin therapy. That's blood sugar monitoring. That's just what the Western medicine does, okay? So what do we do? Hold on, let me see. Mark said, can you discuss how you tailor a diet specific for your patient, please? So Mark, I kind of just said that the diet is based off of, first, we address the inflammation, so like an anti-inflammatory diet, an alkaline diet. Then we, based on our diagnostics of which organ dysfunctions that we found, we tailor the diet specifically to help those specific organs, okay? And then that will address the second cause, and then the first cause of the lifestyles, that depends on which stress is causing them. If it's a chemical stress, we'll address the diet towards, based on their lifestyle, right? Because some patients, actually where I live, it's called a soccer mom community. Do y'all know what that means? Soccer mom community? Means they got a tight schedule. They're chauffeuring their kids or their family around. They're not all soccer moms, but I'm just saying they have a tight schedule, right? And every minute count. They're just like bam, 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 bam. They don't have any free time, right? Everything's scheduled. And so they don't have time to cook. So what do? Right? So that's why they eat takeout, because it's fast. Because they're driving, eating at the same time. So, those situations, I don't make them change their lifestyle in that sense. I let them know that maybe, hey, you need to think about different options, but the current state is they can't change it, and they're going from place to place to place to place. So how can you help them change their diet based on their current lifestyle, right? So there's a lot of this conversation going on and tweaking. It's not just, okay, do these points, acupuncture points, do this diet, do these herbs, and voila, the diabetes is gone. There's a lot of stuff you have to work with the patient, because every patient is different, okay? But we'll get to that later on. All right, patient flow. So what happens, this is a typical patient flow of how a patient comes to our clinic. So I call it the leads. So the leads is, use this one. The lead calls our office. Okay, so I already told you why people call your office, because they want help. They don't call your office just to find out how much you charge for acupuncture. That may be the question that they ask you, but that's not the real reason why they called your office, okay? Because again, when's the last time you know someone who has nothing to do and they pick up the phone and call and open the yellow pages or go on Google and say, hey, let me call every acupuncturist and let me see how much they charge. They just don't do that, okay? The reason why they ask you about your fees is because they don't know what else to ask. So that's the first thing that comes out of their mouth, okay? So it's your job to guide them, to get them into your office so that you can help them. If they never step into your office, you will never help them. Right? Common sense. All right, so a lead calls our office. Then you need to convert that lead to a new patient, right? So you need to get them into your office for a new patient, what I call initial exam. I know some people will do consultations. I've done consultations before, but our first step now is called an initial exam. So we do an initial exam, okay? And then after the initial exam, we start treatments, right? You need to be able to, during that initial exam, you need to be able to communicate to the patient so that they want to start treatments with you. So you need to develop that rapport fast, right? And I can go over what I do tomorrow. That's probably the end of the tomorrow. I said that's probably the most important thing you can learn from me. Patient starts treatments, and then next you want to keep them long enough so that you can get the result that they want, right? So that's kind of the flow of what happens in my clinic. All right, here's something in the to ponder. Do you think type 2 diabetes is curable? And what does it mean to cure a disease? So what does it mean to you to cure a disease? What does that mean? What does that mean?
Whatever the problem is, it ends.
So one person said, whatever the problem was, it ends. Okay, that's one. What other definition of cure? Cure a disease or fix a problem. It's similar. What does that mean to you? Go ahead.
Symptoms don't happen anymore.
Symptoms don't happen anymore. Okay. What else? Able to function.
Balances.
Yep. What's that?
Balances.
Balances. Like what do you mean by balances?
The imbalance.
The imbalance becomes balanced.
Yeah.
Okay, that's good. Curing is different than increasing quality of life. Yes? Everybody's right. So, no more symptoms. Yeah, that's pretty common. Body will start to function. Yes. So, let me tell you my definition of curing a disease or fixing a patient. Our definition of our clinic, this is our goal, okay? And this is what we communicate to our patients. Yes, we want to get rid of the symptoms. Everything y'all said is exactly part of it, all right? So we want to, whatever symptom they came in with, they no longer have. And I would say that the thing that that I stress is restoring their body's function, organ functions, and the last part, retraining their body to heal itself without any treatments. So without acupuncture, without herbs, without supplements, with just diet and exercise. That is the goal that I tell our patients that we try to achieve, okay? So it's getting rid of your symptoms, restoring your organ function, and retraining your body to heal itself so that it's not dependent upon any other treatments. Because I tell our patients, because with Chinese medicine, we're not like medication. Medication, you're dependent upon it. If you stop medication, your blood sugar will go straight up. That's just a fact, right? And with Chinese medicine, we don't want to be another crutch for you. We say that we fix the problem, but what does that actually mean? We fix the root cause. Fixing the root cause means that we fix it so that your body can do it by itself without acupuncture, without herbs, without supplements, right? So that's one of the goals. Now, not every patient wants that. Again, you have to ask the patient, but I'm telling our patients that it's a possibility if you work with us, okay? All right, move on. So prognosis, what can you expect when you implement the program that I'm going to go over? So I call it the Heal Your Diabetes protocol. So 90% of our patients who follow 90% of our recommendations get better 90% of the time. Nothing is 100%, and I don't claim to be 100%. Yes. Oh, I don't claim to because diabetes, a lot does depend upon the patient doing the diet. If they don't do the diet, you're not going to get results. You'll get it temporarily, right? So what can you expect after 1 month? If they are on insulin, you have the ability to help them get off all insulin just in 1 month. That is a possibility. It does require them to follow this dietary program. Not 100%, I would say about 80%. If they can just do 80% of it, they can still get off all of their insulin. The worst case that I had was someone who was on I think it was 40 or 50 units of insulin, and in 1 month he stopped all of his insulin. He was still on his other diabetic medications, but he was able to get off all his insulin because his blood sugar decreased. Okay. After 3 months, potentially the A1C could decrease below 6.0. Okay, so these are expectations. Actually, this slide is also crucial too. Like when you're learning how to treat a disease, this should be the number 1 thing that you're asking. How long does it take? Because guess what? That's what the patients are going to ask. The patients are going to ask you, how long is it going to take? The first, I would say the 3 most common questions that a patient will ask you. Number 1 is, can you help me? Number 2 is, how much is it going to cost? Number 3 is, how long is it going to take? You need to be able to answer these 3 questions before the patient even asks you the question. Because if you do that, you start building authority and you also start building trust. Because that tells them this is not your first rodeo. You've done this tons of times. You already know what they're going to say. Some of them will tell you, hey, you're just like reading my mind. And so if you can do that, they will truly trust and they'll follow your program, right? So after 6 months, potentially your patient could be maintaining their own blood sugar by themselves if you give them the tools. So in our clinic, we actually give them the tools so that they can maintain it by themselves. We don't just say, hey, you come for treatment, we help you do it, and then you got to keep coming to us forever. Okay? Okay, so what happens if patients are only 50% compliant? It still works, okay? That's the beauty. That's the beauty of this program, is it still works. After 1 month, your patient potentially can decrease their average fasting blood sugar by 10 to 15 points. Okay? After 3 months, your patient potentially could decrease their A1C to below 6.5. That's still so much better than someone who has an A1C of 12, right? So they're going to be better off. You're saving their extremities, you're saving their eyes, you're saving their kidneys just by lowering their A1C below 6.5.
And you can let them know ahead of time, even if you only do this 50%.
Exactly. Yes.
Save your eyes.
Yes, exactly. Someone just said, yeah, you can let the patient know, even if you only do this 50%, you could still save your eyes. You could prevent yourself from going on dialysis. You can prevent your, having nerve damage in your hands and feet, right? So that's the beauty of this, right? But if you want to get great results, obviously you want them to follow it as much as you can, as they can. All right. Okay, so we're going to start the initial exam. So the first part is the initial exam. Oh, let me take a break? Okay. I was just getting on a roll. Dang. All right, let's take a break.